Over the past year, we have reported extensively on the heroin epidemic in southern Colorado and across the nation. And when you picture a heroin addict, you might think of a junkie living under a bridge. But it turns out a large number of heroin addicts in America are veterans. And as we found out in a special KRDO Newschannel 13 investigation, not only has the VA struggled to help them, but in many cases, it also helped create those addictions in the first place.
This takes the pain away from, from early childhood, from, things that I thought were wrong but really weren't. It was finally the first time that I felt okay inside of my skin.
That is how Ross Armentor describes the first time he used Percocet, a powerful painkiller containing the opioid OxyContin. A VA doctor prescribed it for a torn hamstring shortly after the senior airman helped to overthrow Iraqi dictator Saddam Hussein in 2003. Within a few months, he was addicted.
2 became 5, 5 became 10, 10 became 50, and the saying is that 1 is too many and 1,000,000 is never enough, and that was definitely my story.
Despite a dramatic dosage increase, the VA never questioned his motives.
I was getting abnormal amounts of painkillers and anti-anxiety medicine.
And it wasn't a big deal.
And it wasn't a big deal. It would come in the mail every month, right to my doorstep, and it was like going to order lunch.
But eventually the painkillers became too ineffective or too expensive, so he turned to heroin. A top VA pain management expert recently testified to Congress that almost 60% of veterans returning from the Middle East have some form of chronic pain requiring treatment. And our investigation found that 63,880 veterans were treated in 2015 for an opioid use disorder. In 2013, the VA released its Opioid Safety Initiative, directing its staff to prescribe less opioids. However, earlier this year, Colorado Congressman Mike Kaufman said there is still a prescribe-first mentality among VA medical practitioners. VA physician Christine Glass disagrees, claiming that decision is ultimately up to patients like Ross.
Because the patient always has the right to choose. It's our job as physicians to educate so they make the correct choice.
Ross doesn't question the commitment of doctors and other medical practitioners in the VA system. He says they are simply overwhelmed and can't provide the same quality of care as private facilities, nor can they provide it in the same timely manner. Ross tried the VA.
And I said, hey, can you help me? I'm dying here. I'm going to die, right? And they said, well, in 21 days we can get you a bed. Well, in 21 days we die from this disease.
The average wait time for a VA specialty clinic visit in Colorado Springs as of October 15th was 28 days. Dr. Glass says the treatment is improving.
I do see things moving forward, and change does take time, but we're doing our best to educate from the mandates from Washington, D.C.
But Ross worries the scale of the epidemic is outpacing the VA's lack of bed space and individualized care.
In my opinion, when you have socialized medicine, everybody's treated the same, right? And so the doctor doesn't ever get to know me. He doesn't know my story, nor is he going to ask. I'm a number to him, right? And so the better individualized treatment that I got from an outside source is what ended up saving my life.
Armentor now runs a successful sober house in Denver, using what he learned from his own experience to help others. More than anything, he wants the community to understand that heroin addicts are often veterans, professionals, or affluent teens living in the suburbs, not junkies, and he believes a larger conversation is necessary to truly reduce the epidemic. If you need help or know someone who does, you can find a link to lots of resources on our website, KRDO.com. Our article also includes links to the most current VA wait times.